Hello, everybody. Thank you so much for joining us and watching our Health Vision Council training. So I'm going to go ahead and jump right in. This meeting is being recorded and will be posted on our website in a little bit. So just hold on one second while I share my screen. Get to that in a little bit. Let me go to the top here. Okay. Okay, great. So like I said, thank you so much for joining us this morning on our Health Vision Council training. So I'm just going to hop right in. So you will be working with me. My name is Katie Wise. I'm the Director of Community Impact here at United Way of Horry County. And I am over the grant process. And so any questions that you may have about the grant, about the Vision Council process, about anything relating to this process, you will directly be working with me. And I'm always happy to hop on a call, send me an email, text me, anything like that, to answer any questions that you may have. But first of all, I just want to say thank you so much for volunteering. We could not do what we do without our volunteers throughout this process. And so we really just appreciate you taking the time to sit down with us and to really kind of help us determine where our investment dollars are being distributed in the community. So we really just appreciate everything that you all are doing for us. So this is kind of the agenda that we're going to go through today. We're going to kind of talk about who we are, do an overview of the health pillar in the community game plan, expectations of a Vision Council volunteer, and an overview of what to look for in the application, and then the timeline. So who we are. So since 1973, United Way of Horry County has faithfully served the community. We are led by a volunteer board of directors who live and work in this community. Our vision statement is we envision an equitable community where opportunity is not limited and every member reaches their full potential. And our mission is we want to achieve our vision by uniting people, ideas, and resources to advance the common good in Horry County. And so these are our focus areas. And so we focus on health, education, self-sufficiency, and basic needs, but we also have bold goals, specific bold goals underneath each one that we are trying to accomplish. And we do this by the grant process, and also we align all of our internal programs with these bold goals as well. But for our 2024 grant, these are our focus areas. So you all will be specifically focusing on health, but I did want to kind of show you kind of where our other focuses and our other pillars. So for health, very, very focused on mental and behavioral health. So we want to decrease the number of suicide ideations and attempts and decrease the number of drug-related overdose deaths. For education, very focused on early childhood education. So we would increase the number of children who meet developmental milestones and enter kindergarten ready. And we also want to increase access to equitable learning opportunities and high quality childcare for children and youth. For self-sufficiency, we want to increase the number of Horry County residents meeting self-sufficiency standards. And for basic needs, we really just envision a future where everyone has access to food, shelter, clothing, healthcare, basic materials, transportation, and a sense of security. So we're going to dive a little bit more into health. So our bold community goals, as I said, were decreasing the number of suicide ideations and attempts and drug-related overdose deaths. We envision a future where behavioral health needs for children, youth, and adults are recognized and validated. And we seek to increase knowledge of issues related to behavioral health needs and improve access to available community resources and services. And so in our community game plan, and I will send this out to everybody just so you can kind of have the document in front of you. But for each of our pillars, we have 4 strategies. And so we outline what we're going to fund, what we're going to advocate for, who we're going to collaborate with and how, and what we want to educate the community on. And so for this training, we're going to be focusing on what we're going to fund because this directly impacts the grant process. And we're going to be funding agencies under the health pillar that align with this. And so we want to fund programs that improve outcomes and access to behavioral health services for children, youth, and adults, and programs that will raise awareness of an intervention in unhealthy behaviors. And so this is really important. So we have measurable objectives that we have outlined in our game plan. And so we want to be able to measure We want to improve outcomes of and access to behavioral health services for children, youth, and adults. And we also, our second objective is children, youth, and adults will utilize services that support the family and promote positive emotional and psychological and social well-being. And so this is something that'll be a little bit different than how it was last year. And so the United Way of Horry County, we are implementing the results-based accountability framework, and which means it's asking these 3 questions outlined here at the bottom. How much are we doing? How well are we doing it? And is anyone better off because of it? And so on our application this year, we have created what we're calling shared measurements and shared performance measurements. And it all goes back to the collective impact model, where having shared measurements means that we can have shared impact, and we can also have shared accountability. And so agencies will be selecting from a catalog of United Way, kind of the shared performance measures and outcomes that we've created. And I'll kind of show you what that looks like. So this is just an example. This is actually from our education goal, but I just wanted to kind of show you kind of like how it looks. And so you can see here where we have our measurable objective, and then we have the 3 questions underneath. How much do we do? How well did we do it? And is anyone better off because of it? And so you can see that each one has like the specific performance measurements in there. And so we came up with these we worked with our vision councils and our task force that we were working with back when we were originally transitioning to this more focused model back in 2021. So kind of looking at kind of what are the agencies already measuring? What are some of the things that we can measure to truly like track if we're moving the needle on these issues? I spoke to several other United Ways kind of measuring, kind of tackling the same issues and the shared measurements that they were using. And United Way Worldwide as well also has what's called the Global Results Framework. And so where we got a lot of these shared measurements from as well. And so this idea of shared measurements has kind of gone several United Ways across the country have implemented this. And now, so it's really just a way that we're all kind of speaking the same language and that we can truly have that shared impact and that shared accountability, and to also be able to see kind of like where are their gaps, you know, are the programs that we are investing in and that we're doing that, you know, it just kind of gives us an idea of, you know, kind of looking into our own organizations to see, is what we're doing working? Do we need to adjust anywhere? Let's keep doing this and all that kind of good stuff. And so on the application, each agency is required to choose at least one measurable objective for under the pillar of the bold goal that they're applying for. So the agencies that are applying under the health pillar will have to choose at least one of the measurable objectives that I was mentioning earlier. And I do want to say too, that we did kind of give the shared measurements to our currently funded agencies to kind of look over to see, you know, do you fit in here? Are there things that we need to take out? Are there things we need to add in here? Different stuff like that. So we've gotten their feedback. And I will share those measurements with you all as well whenever the call is over. And they are also available on our website as well. But I just kind of wanted to say that before. But yeah, and so under that chosen measurable objective, agencies must choose at least one performance measurement under each question. And so back in those 3 boxes, they'll have to choose at least one of the identified performance measures in there. So how much do we do? How well do we do it? Is anyone better off because of it? And so in addition to the required measures, they are welcome to create their own performance measures as well if they're measuring something that may not be on the list. And I do just want to note that this is the first year that we are implementing this shared measurement kind of idea. And these measurements can be modified and adjusted over time. You know, we welcome feedback to fine tune the shared measures. It's something that I'm going to be working with the agencies really closely with to kind of see, you know, what can they measure, when can't they measure, you know, and all that kind of good stuff. So this is really just kind of like a starting point to see, you know, are we kind of on the right track to kind of track the things we need to move the needle on the bold goal. And so why use volunteer reviewers? we want to include a wide variety of perspectives and experiences that can inform the grant making process, and making the granting process more inclusive, transparent, fair, and as free from influence and bias as possible. So who are the reviewers? All applications will be read and scored on a weighted evaluation by our 4 vision councils. So we have health, education, self-sufficiency, and basic needs. And they're all comprised of, issue area experts, but people that are kind of like focused like in this behavioral and mental health field. Some of our board members are going to be serving on the vision councils, community members that are interested in getting involved, and United Way of Horry County donors as well. And there will also be a finance vision council where they'll be reviewing all of the financial documentation turned in with the grant. So like their audit, their 990s, their profit and loss statements, and all that kind of stuff. And so you can look at those, but we are having like a finance committee where that's all they'll be really kind of looking at and diving into. So the Vision Council's volunteers, they help us determine how undesignated United Way of Horry County annual campaign donations will be distributed to local agencies and services throughout Horry County to make a lasting impact. And we are asking that all Vision Council members donate at any level to United Way of Horry County, because this really allows you to have skin in the game and to have a say in where your dollars are being invested. So what's in it for you? Learn about the grant making process. This is what kind of goes into a grant, kind of how our agencies funded in our communities. Gain a better understanding of who we are at United Way of Horry County. But you'll also, learn about the innovative programs and the best practices across Horry County. This is the best way really to kind of see who else is out there, what are these other programs doing? And it's such a great process to kind of see and really work with these agencies. And you'll be able to have a voice in the process. So overall expectations of the reviewers. We ask that you please keep the applications and scores confidential. This is not public information until the grants are awarded. And we ask that you review the application and score each one using the Community Impact Vision Council scorecard. And so we do have a scorecard that you all be using to kind of help guide your scores and to help you kind of be looking like to see like what you all should be looking for. And so you all will be assigned all of the applications under the health pillar to review. And so this is something a little bit that we changed from last year. It just really gives the volunteers just kind of like a really great idea of like who all is applying under the health pillar. So we are asking that you all review all of those under there. There shouldn't be, last year we had about 5 or 6 under there, so it's not too strenuous. But we'll obviously keep you updated on to how many we have kind of as they're coming in. We ask that you please report any conflict of interest to United Way of Horry County and don't score proposals in which you have a conflict. So if you are serving on a board of an agency, or if you volunteer regularly at an agency in Horry County, or if you or a family member, someone yet has received services from an agency in Horry County, we ask that you don't have anything to do with them throughout this process, because we don't want any bias or any influence coming in. So about the application. So our applications are opening on May 22nd, and they're for 1-year grants. And so for January 24th to December 24th. There's a little eligibility form that they'll have to fill out first. So all agencies will need to request access to that full application by filling out an eligibility form by June 2nd. And then the applications will close on June 30th, and they'll close at midnight. So what we'll be looking for, we want to see them align with at least one community goal in the game plan. And we recognize that these agencies have, that they're able to align with maybe several of the bold goals, but we do ask them, like, which one do you most align with? Which one does your program best align with? And then we also are looking for alignment with at least one of the measurable objectives, as I was mentioning before. Have they identified the need? How do they involve their volunteers? What's their fiscal strength? What's their scale and scope of their program, and their capacity and infrastructure for long-term sustainability? So reviewing the applications, we ask that you read our game plan, mainly the health pillar, become familiar with, the goals and strategies that we have in there and our funding eligibility requirements. We ask that you read the scorecard first to really kind of get an understanding of what we're looking for. And please make sure that you set enough time aside to review each of your applications thoroughly. This isn't a quick process. We normally say it probably takes about an hour or so to really review like one full application. And so after the applications close, kind of like that first week in July, that is when I will be assigning the applications to you all as the Vision Councils. So we ask that you do an initial read of each application, but don't score them the very first time. Use this initial review of the application to get a general sense of what they're proposing and where to find details important for scoring. I will be available for any virtual check-ins, any questions, clarifications, guidance throughout this entire process. And so after you've kind of done your initial review, we ask that you reread each proposal and begin scoring from there. Use the questions on the scorecard to guide you, and make sure you write down, the strengths, the weaknesses, the support, the support end of your scores, notes, and questions. We will have like comment boxes on the scorecard for you to write your notes in. And proposals should make a strong case showing a compelling need and show that the proposed activities will effectively address that need. Tips for scoring. Everyone scores differently, and that's okay. Just make sure that you're consistent with your scoring. Only score an application based on the information provided and don't assume anything. And definitely don't score applications against each other. Only score them against the scorecard. And make sure that your scoring is primarily based on the quality of responses. So just having an answer to each question doesn't necessarily justify a high score. We really are looking for the quality of the answers here. And so it's kind of the step 2 in the process. So those last few weeks of July, beginning of August, the Health Vision Council volunteers will have like an application review meeting to kind of discuss the kind of like our initial thoughts, the questions we want to ask in the site visit, and all that kind of good stuff. And so we ask that you come to those meetings ready to discuss the applications. We ask that you have all of your initial scoring complete. We'll discuss, like I said, the strengths, weaknesses, and scoring of each application. And the reviewers will decide on questions to ask the applicant agencies in their in-person site visit. And so we do site visits with our agencies. We go to their site to see where the services are being performed, and they'll kind of give us a tour of the agency, and then we'll have time to ask questions. And that's kind of where I kind of led right into that. So like the first few weeks in August are when we will schedule time to conduct 1-hour site visits with applicant agencies. And here is where you will see investment dollars hard at work. And we'll get to ask the questions about the application and their agency and or their program. And then after the site visit, we'll have the opportunity to go back in and rescore the application if we need to. Like if there was somewhere that we scored kind of low because we had a lot of questions on, the agency was able to answer it, we can go back in and rescore that to come up with our final score. I also want to note too that you don't have to go on every single site visit. We'll kind of divvy up the volunteers to kind of see like kind of who can go to what, but we are asking that everybody read all of the applications under there. So then that way, when it comes to making our funding decisions, everyone at least has an idea of kind of like who's applying and what for. So then in the middle to September, we'll meet all together in person with our allocations chair on our board of directors in meetings to make final funding recommendations to then be brought to the board of directors meeting for our board of directors meeting in September for where they will have the final approval. So final tips. For every grant process, there is not enough funding to fund all of our requests, so definitely keep that in mind. There's always more than one review group, scoring different applications. And it's important for the volunteers to carefully score these proposals because we really rely on you all to recommend funding for the programs with the strongest chances of being successful. And so EC Impact is our online grant management system for the grants and for our Vision Council volunteers. And so you will review and score the applications using this system. And so I will show this to you, kind of what it looks like. And so whenever you log into EC Impact, I will show you, I will go over here. This is like our test volunteer. This is what it looks like, and you'll see the evaluations that you have been assigned. And so you'll go over here and see, click here to get started. And I will have all the instructions for everything for what you need to review, kind of how to use the system and all that kind of good stuff. And so, and down here is where your evaluations will be for the programs. So you can just click on that. And then here you'll see the full application that you'll be able to go through. But then over here you have evaluate. And so as you're doing that, you can go ahead and kind of you can start kind of looking at what we need. And like I said, there will be comment boxes added in here. I'm still working with the grant system to kind of make sure that everything is good to go and ready to go before the grants open, before you all really kind of start getting in here. And so, but yeah, this is kind of what everything looks like. And then down here, if you're not done, you can save my work. And then when you are done, you can mark it as completed. And up here, you can jump to any section if you don't want to like scroll all the way through. You can visit the agency's website. And then back here, you can see the My Assigned evaluations. You can also print it as well if you wanted to. And that way it's easier for you to kind of read and make notes on. And then you can kind of go back into the scorecard and make changes from there. Oops. And so that is kind of what the system looks like. If you are new to EC Impact, I would be more than happy to kind of work with you to get your login set up and to kind of like show you a little bit more individually, kind of like what the system looks like once all the programs and all that are in there. And so I will send all the information out to all of you to make sure that you all get assigned to your programs and that you are able to log on to the system and all that kind of good stuff. And so if you have any questions, like I said, please feel free to reach out to me. I will be in touch with everybody. I will be sending out this recording and also the PowerPoint as well. That way everyone still has this information. But like I said, I'm still available for one-on-one calls as well. But thank you so much again for everything. I look forward to working with you all this summer. Thanks so much and have a great day.